Have you ever heard that garlic can be harmful to certain health conditions? Yes, you heard right. Garlic, the humble kitchen staple, is almost ubiquitous in its use. From lending that unique flavor to your favorite pasta sauce, to its prized role in traditional medicine, garlic has been the star of the show for centuries. Known for its antibacterial, antiviral, and anti-inflammatory properties, it's no wonder that garlic is often hailed as a superfood. But like every superhero, garlic too has its kryptonite. While it is packed with compounds like allicin, which can combat heart disease, and sulfur, which aids in detoxification, garlic can also prove to be a foe for certain health conditions. It's a classic case of what's one man's food is another man's poison. Now you might be thinking, but garlic is natural, how can it possibly be harmful? That's a valid point. However, it's important to remember that natural doesn't always mean safe for everyone. Nature is a double-edged sword, and garlic, with all its glory, is no exception. For instance, did you know that consuming garlic can complicate certain surgeries? Or that it might interfere with medications leading to adverse effects? Surprising, isn't it? And that's just the tip of the iceberg. There are several other health conditions where garlic might be more of a villain than a hero. But don't worry, we're not here to demonize garlic. It's still a valuable player in our diet and health regimen. But it's crucial to be aware of when and for whom it might pose risks. Remember, knowledge is power. By understanding the potential pitfalls of garlic in certain health scenarios, we can make informed decisions about our health. After all, our bodies are unique, and what works for one might not work for another. So, are you ready to uncover the lesser-known side of garlic? To learn which health conditions might need to tread cautiously around this pungent bulb? It's time to lift the veil and expose the truth about garlic. Let's delve into the specific health conditions that garlic can potentially harm. Firstly, we have the issue of blood thinning. Garlic, beloved for its culinary and medicinal properties, also has a less-known side. It is a natural blood thinner. This means that it can enhance the effect of medications designed to thin your blood. Now, you might be wondering, isn't blood thinning a good thing? Well, yes and no. While blood thinning can prevent clots, excessive thinning can lead to issues. It can increase the risk of bleeding, both internal and external. Imagine a simple cut taking longer to clot and stop bleeding. Or worse, imagine an internal bleed that goes unnoticed. These scenarios can be potentially life-threatening. And if you're already on blood thinners like warfarin or aspirin, garlic can amplify their effects. This is why it's crucial to maintain balance. So, if you're on blood thinners, it's wise to go easy on the garlic. Next up, we have surgery. Now you may be wondering, what does garlic have to do with surgery? Well, it turns out quite a bit. You see, garlic is famous for its blood-thinning properties. This can be beneficial in many scenarios, but when it comes to surgery, it's a different story. When we undergo surgery, our bodies need to form clots to stop any excessive bleeding. But, with garlic's ability to thin our blood, it can make it more challenging for these clots to form, increasing the risk of bleeding during and after the procedure. So, if you're scheduled for an operation, it's advisable to stop consuming garlic at least 2 weeks prior. This gives your body the chance to clear out the garlic and its effects, ensuring that your surgeon can do their job without any unexpected complications. Remember, safety first when it comes to surgery. It's always better to be safe than sorry. Moving on, let's talk about gastrointestinal problems. Garlic, with its potent aroma and flavor, can be a bit too much for some people's digestive systems, particularly for those grappling with conditions like irritable bowel syndrome, gastritis, or ulcers. Garlic might not be your best friend. Why so? Well, garlic is strong in nature. It contains compounds like allicin, which may cause irritation and inflammation in the gut lining. This can exacerbate the symptoms of these conditions, causing discomfort such as bloating, gas, or even stomach pain. Moreover, garlic's potential to stimulate the gastric system could lead to an increase in stomach acid production. This can be particularly troublesome for individuals with existing acid-related conditions such as ulcers or acid reflux. So, while garlic is often hailed for its health benefits, it's important to remember that it's not for everyone. If you're dealing with any GI conditions, it might be best to hold off on the garlic. Now, let's consider low blood pressure. Garlic, as many of us know, has been hailed as a home remedy for high blood pressure for centuries. But did you know it can also lower blood pressure too much in some cases? Yes, that's right. Garlic contains allicin, a compound that can cause a significant drop in blood pressure. This is a boon for those with hypertension, but for those already dealing with low blood pressure, it can potentially exacerbate the issue. Imagine a seesaw. If one side is heavier, the other side lifts up, and if it's too light, the other side drops. Our blood pressure works similarly. It needs to be in balance. Too high is problematic, and so is too low. Therefore, if you already have low blood pressure, consuming large amounts of garlic can push your blood pressure down further, possibly causing dizziness, fainting, or other complications. People with low blood pressure should be cautious when adding garlic to their diet. Next, we have skin irritations. Now, you might be surprised to learn that garlic, despite its myriad health benefits, can also be a culprit behind some skin issues. Not everyone can tolerate garlic in the same way. For some individuals, it can trigger skin irritations, like rashes or hives. This is due to a compound in garlic known as allicin, which can cause an allergic reaction in susceptible individuals. Interestingly, this reaction can occur whether you're consuming garlic internally or applying it topically. So if you're thinking about using garlic-infused products for your skincare routine, you might want to rethink that idea. And it's not just about allergies. Even if you're not allergic, excessive garlic consumption can lead to skin problems like dryness and peeling. So moderation is key here, folks. In a nutshell, while garlic is a fantastic natural remedy for many health issues, it can also be a trigger for skin irritations in certain individuals. If you're prone to skin issues, it's best to be cautious with garlic. Let's not forget about pregnancy and breastfeeding. It's a phase of life where every morsel that a mother consumes can impact the little one growing inside her or feeding on her milk. Garlic, despite its numerous health benefits, is one such food item that requires caution during this delicate time. When consumed in large amounts during pregnancy or breastfeeding, garlic can result in a change in the baby's behavior. The strong flavor of garlic can pass into the breast milk, causing the baby to nurse less frequently. This can lead to weight loss or slow weight gain in the baby, making it a matter of concern. Moreover, some studies have suggested that excessive garlic intake can lead to colic in some infants. Colic, characterized by frequent crying and discomfort in babies, can be a stressful experience for both the baby and the parents. Therefore, while garlic can be a healthy addition to a mother's diet, it should be consumed in moderation. For the safety of the little ones, moderation is key. Last but not least, medication interactions. Garlic, while a delicious addition to many dishes, can also complicate the effectiveness of certain medications. It's a little-known fact that garlic can potentially interfere with the way some drugs work, specifically those used for HIV/AIDS treatment. At the molecular level, garlic produces a compound called allicin. This compound, while beneficial in many ways, has been shown to interact with certain medications, causing them to be less effective. This can be particularly concerning for individuals living with HIV/AIDS, where maintaining the effectiveness of their medication is crucial. It's not only HIV/AIDS medications that can be affected. Garlic supplements can also interact with medicines like warfarin, used for thinning blood, and insulin used for diabetes. This can lead to health complications if not properly managed. The takeaway message here is clear. If you're on any medication, it's important to talk with your doctor before increasing your garlic intake. They can guide you on whether it's safe or not. Always consult with your doctor if you're on any medications and considering adding more garlic to your diet. So, as we've discovered, while garlic is generally a health superstar, it's not for everyone. Let's take a moment to recap what we've learned today. First, we delved into the potential issue of garlic's blood-thinning properties. While this can be beneficial for some for others, especially those already on blood-thinning medication or suffering from bleeding disorders, it can pose a serious risk. Next, we talked about the implications of garlic before surgery. Due to its blood-thinning properties, garlic can potentially lead to complications during and after surgical procedures. It's always important to discuss your dietary habits with your doctor or surgeon in the lead-up to any operation. Then we examined how garlic can affect those with gastrointestinal problems. Garlic can be a trigger for some people, exacerbating symptoms of heartburn, acid reflux, and irritable bowel syndrome. If you're prone to these conditions, you might want to consider limiting your garlic intake. We also looked at the impact of garlic on blood pressure. Garlic has been shown to lower blood pressure, which is generally a good thing, but for those already dealing with low blood pressure, it might push it too low. We explored the potential for skin irritations caused by garlic. Some people can have allergic reactions to garlic, leading to skin rashes or burns, especially when applied topically. we discuss the precautions pregnant and breastfeeding women should take when it comes to garlic. High doses of garlic can potentially affect the baby's development and flavor breast milk, so moderation is key. Finally, we highlighted the issue of garlic interacting with certain medications. Garlic can interfere with the effectiveness of some drugs, including those for HIV/AIDS and birth control. In conclusion, while garlic is a potent and beneficial herb, it's not always the right fit for everyone. It's crucial to understand your own health conditions and how they might interact with your diet. Remember, when it comes to your health, there's no one-size-fits-all solution. Always consult with your healthcare provider before making significant changes to your diet or supplement routine.